The following program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host, Kimberly Brummel, and welcome to the 20th episode of American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we inform you about breakthroughs in medicine, educate you about the growing concerns medical professionals, politicians, and experts alike have about Obamacare, and highlight the work of Dr. Alfred Bonati and the Bonati Spine Institute. We recently traveled to Tennessee to check up on some of our patients' miraculous recovery stories. In our final segment, I'll speak with Dr. Bonati about the recent elections and how this could help us reverse some of the problems with the so-called Affordable Health Care Act. He will also discuss how taxing inventors of medical products are hindering the development of advancing medical equipment. Introducing our first guest is radio program executive producer and co-host of American Medicine Today, Ethan Euchre.
Thanks, Kimberly. Every Saturday at noon, we are joined by interesting guests who shed light on the growing concerns many Americans have about their medical care.
The patented Bonati spine procedures are leading the way in minimally invasive spine surgery exclusively performed at the Bonati Spine Institute. A recent 7.5-year survey shows a patient satisfaction rate of 98.75%. Dr. Bonati dramatically changed the way conventional spine surgery was performed.
And following in Dr. Bonati's quest to find medical experts who are pushing beyond conventional methods of medicine, today we'll follow up with Dr. Stuart Hart. He's from the University of South Florida's Center for Advanced Medical Learning and Simulation.
Ethan and I had a chance to receive a tour from this world-renowned, one-of-a-kind medical training facility and see some of the products that they are creating to advance medical procedures and training. We're here in Tampa with Dr. Stuart Hart, Medical Director of Tampa Bay Center for Research and Innovation Center at CAMLS in Tampa. So, Dr. Hart, why don't you explain to everyone watching what CAMLS is and what you do?
So CAMLS is a world-class medical facility for training all healthcare providers. We are the largest freestanding healthcare education, training, and simulation center in the country, and our goal is about training the next generation healthcare providers. How can we improve healthcare through training?
What I liked is your analogy that CAMLS is sort of the Taj Mahal of learning centers for medical students around the country. And it's 90,000 square feet, correct?
Correct.
And what sort of things are you, we have yet to be shown around here, so what sort of things are we going to check out today?
So we're going to start with the Surgical Interventional Training Center, which is 39 high-end surgical skill stations, where we can immerse learners in any type of operating room or procedural room environment. And so we have all the latest technology to train the next generation of healthcare providers.
The thing I found interesting was the fact that everything is so hands-on. It really sparks that creativity and innovation. And quite honestly, I personally can't wait to see the synthetic cadaver. That's one that impresses me. That and the 3D printer.
The 3D printer you have, and actually I know Kimberly was all excited about this. We're actually going to gown up and sort of have Dr. Hart run us through, I guess, a simulation, correct?
We're going to have you perform surgery today.
I can't
Love
wait.
it.
So this is our anatomy table that we use to train medical students, nursing students, all the way up through physicians that have been practicing for many years. But it allows us in a 3D format to teach anatomy without having to go to a cadaver lab. Going to a cadaver lab is very expensive, it's time consuming. If a provider, a clinician, wants to learn about an area of anatomy that they may not be as familiar with, we can come up here and we can in 3 dimensions zoom in and out of that particular anatomy and teach them the relationships, because it's typically the relationships between anatomic structures that's so important, especially to a surgeon or to any type of provider that performs procedures. So this is the vascular system right here.
So I got to imagine in the long run, given what does a typical cadaver cost and how difficult are they to get? I was just going to say, because this has got to be an extremely expensive machine, but I would imagine over time, not having to pay for cadavers and things like that, it ends up paying for itself.
Right, and there's several issues with cadaver. There's cost, there's time associated with it, and there's availability of cadavers and the appropriate cadavers. that have the areas of interest that you're trying to teach. So we eliminate all this with technology. So we can come up to the center, come in this room, and really hone in on that area of anatomy that needs to be learned for that particular procedure or situation.
How much more can you kind of dissect, so to speak, on this table? Are you able to cut into what we're seeing here?
So let's go back to the full patient, and then we'll cut through, and then we'll show you how we do this. It's just like surgery.
Now, certainly it is going to differ from a cadaver from certain perspectives. Like, say you were going to try to do a surgical approach, certainly you can't tell by just touching the screen, correct? I mean,
Correct.
It's going to have some limitations.
Right. And so for procedural training, surgical training, you want a cadaver, you want other type of simulation tools.
Right.
But to learn the anatomy, which is the basis for surgery.
So it's a good introductory tool.
Great introduction. So we'll walk through, so you can take a real patient, and we can cut through in any location. So you can go ahead and take your finger,
Which,
any place. You can even do diagonal.
okay.
Now you can rotate it. And now we can see from that angle what the anatomic structures were affected by your cut in that area. And then we can zoom in and out. Right, this is a surgical simulator that we built here at CAMLS. This feels and looks exactly like skin. This is our synthetic skin that we actually designed and built here. And this is a simulator that we built here. And within the simulators contain bowel. So today we're practicing bowel type surgery, and that's why we're putting you through these tasks currently.
Oh, I think I just heard him. It's a very strange feeling, you know, for someone who is clearly not used to it.
Right now, would you say with all the twisting and motions we're doing, this would cause an irritable bowel?
It could cause irritation. You could tear the bowel too. As you saw, grasping here, you actually ripped into the bowel.
Yes.
So it requires a certain degree of movement, and you have to grasp the bowel or the tissue in certain areas and very carefully. You don't want to tear into tissue because then you get bleeding and other damage.
I think you lost your bowel.
I think I did. I ruined my patient's bowel here.
It's out of the surgical visualization.
It's very, very cool though.
But the movements of these, especially, they're hard to for me, to manipulate. But
It's just awkward and alien.
It does. It feels extremely awkward. Again, this is something that the doctors are going to be used to doing,
Correct.
so they're used to these motions, unlike us that are getting on these for the first time.
Right, surgeons spend years training to be able to perform these type of surgeries.
Correct. Now, the synthetic skin feels pretty real, but there was something you showed us on a table over there that was much more skin-like, and it
Correct.
actually had like a grainer texture of skin. Why don't you tell us a little bit about that?
So this is a silicone-based skin.
Okay.
So it can be used to train how to close incisions for laparoscopic and endoscopic type trainers. We use it a lot to build our simulators. But we also have a water-based tissue that really simulates lifelike skin. And so we use that for other types of simulators. And so we're building a simulator that will allow doctors to perform an entire hysterectomy. And so this is a manipulator that we use in surgery. And so we're going to have an abdomen over top. We're building it right now, so it's actually going to be a little bit wider. We'll have a full abdomen.
Okay.
And we can drape it just like we did back there, and we can perform full surgery. But so we're looking deep in the pelvis.
Okay.
And so we have the uterus, and we're able to manipulate the uterus. We have the ovaries and tubes. And so this will simulate a hysterectomy procedure. And we're using the manipulator to move the organs in the area that need to be moved so we can properly perform the procedure. But we can do this for any type of simulation. So we can do this in colorectal surgery or general surgery or urology. We can build these type of models, and we do here. So doctors are trained on realistic type simulators.
What sets this apart from models that are already on the market and exist? Why did you have to develop a whole brand new one here at CAMLS?
Many of the models on the market are plastic, and so they're not realistic. This is a synthetic material that is very realistic and lifelike. So this actually feels like a real uterus. This feels like an ovary. The ones currently are more plastic-based, and they don't feel like they're doing like they're really operating, but they're not doing an entire surgery. Typical models that are out there, you can do little parts of the surgery, but not the entire surgery. With this model, the surgeon is actually going to come in and do the entire procedure, just like they would in the operating room.
And you said this is still kind of under development. How long do you think before it'll be operational?
We'll have this done within probably a month or two. And we plan on using this in our teaching courses, so this will be used by gynecologic surgeons, hopefully from all over the world, that will come here to train.
At the Bonati Spine Institute, all of the procedures are performed here at our 11-acre facility, from your initial consultation and exam to x-rays and MRIs and our on-site imaging center. All surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows the surgeons more access to their patients and allows you to go home the same day. We'll be right back to hear from a Bonati Spine procedure recipient in our Back to Life segment.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
We recently went to Chattanooga, Tennessee to check in with some of our Bonati Spine procedure recipients for our Back to Life segment.
I'm Clayton Greenleaf. I'm 63 years old. I live in Collegedale, Tennessee, and my passion is restoring old vehicles. I enjoy restoring old cars. Probably close to 50 years. Years ago, when I was in my 20s, I injured it lifting cordwood, I worked in the woods for a little bit, for a logger. And then the job that I had before, I was restoring cars a lot. I was working in a regular body shop, with wrecks, and I was on the frame machine, which is brutal. You're up and down, you have big chains and pulleys and hydraulics, and and you don't think you're going to hurt yourself because you're young and full of vim and vigor, but after a few years, when you fall off the machine and you twist your back and you're underneath and all bowed up, and after a few years of that, it takes its toll. I was in pain all the time, couldn't sleep well, couldn't sit down, couldn't lay down. I was in pain constantly. Taking a lot of painkillers. I was taking painkillers probably, I'd say 5-6 years, and my back kept getting progressively worse and worse, and I kept going to work when I shouldn't have, but it's a lot of it's denial. You do what you got to do. Then all of a sudden, I got to a point where I couldn't do what I do. It takes its toll on you mentally, emotionally. I'm retired now, but I still restore these old cars for people, and it was taken away from me before this surgery. I mean, I was done. I couldn't handle that. I couldn't do anything else. I was all done, as far as like activities go, it would just be severe pain every time I try to do anything. So I just sat here in the chair and watched television.
He's not telling the whole story. His back was so very bad. He was so depressed. It's like it went on for weeks and weeks. He tried doctor after doctor locally, and they treated him the best that they knew how, but nothing worked for him. And it got to the point where I didn't really know what to do for him or to do with him. I was so concerned about him and his frame of mind because of the pain, and thinking that there's no help out there.
Finally, a man associate of mine who also works on cars told me about Bonati because he had his surgery there, and so I called up and went through the process, and it was only about 2 weeks after I called I was at Bonati's having surgery. As soon as I walked into the Bonati Institute, the greeter at the door puts you right at ease. I mean, you went in there 15 seconds, and it, you know, it was a very calming experience, and they were all really nice, and the system was real good. You went through, you know, 1, 2, 3, everything was done, and it took a lot of the nervousness, pressure off, you know. I had 3 surgeries, and after the first one, I went back to the place where we were staying, and the next morning I got up and walked around the block, and I hadn't been able to walk that far for, I don't know, a couple of years, and it was amazing. Well, to tell you the truth, I got very emotional. Being able to walk without pain for the first time in years, it's very emotional.
They're going to get a good prognosis. If they have pinched nerve pain, there are good chances that we can eliminate the pain or make it tolerable so that they can go through normal activities of daily living. People don't come here to be patted on the head or to be given medicine. People come here because they have pain which is truly affecting the quality of their life. Being able to have a positive impact on that pain is very rewarding.
The part that I liked was, you know, after the preparation for the surgery and everything, and then after you get out of the recovery room, I mean, you could just get up and walk.
The patients get up, there's so little recovery time, they are happy, they are pain-free. That's the key, and they get their lives back.
I can't hardly describe it. It's like being let out of jail. You know, you got a new freedom, got a new lease on life, and I can do my work on these old cars, and don't have to worry about pain. You know, and the freedom of movement and doing what I want to do, and I can ride motorcycles now. And I rode motorcycles when I was younger, but I could say, you know, before I had the surgery down there, I was just done. I couldn't ride a motorcycle. I couldn't even get on it, never mind ride it. You know, so this is great. 41 Chevy.
In one hand and welding torch in the other.
Yep.
Literally cutting and welding it together. Cutting and welding it together.
That's right. Yep. All bowed up and
no problems.
No problems. Yeah. Drag it out of the field and woods like that. It's a little pride and joy. Mostly pride. Al and I were out in his garage in the summertime building this. Oh my goodness. Oh man, this is great. Only in America.
Well, it's amazing to see somebody who is sick and is without hope and has situations where they were already told that nothing can be done, and we can correct that.
Can you imagine a bad back taking all this away from you, all this fun?
All my pain is gone, gone.
Today I am totally pain-free. Nothing. No after effect.
It gave me my life back.
I am feeling great.
I feel 100% better, like a new person.
I'm pain-free, and I have had to take any pain medication.
Today I'm completely pain-free.
I only wish I'd known about it earlier. Right now I am completely without pain.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible.
Today I am pain-free for the first time in over a year, and it is so awesome.
It's just wonderful.
I feel fantastic.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
It is just absolutely amazing.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
So I'm hoping to be climbing hills in a few weeks.
When I first met him, and he reviewed the MRI, and was, while reviewing the MRI, was saying, you have a problem here that gives you pain. It should have pain here. And it's like, well, exactly. Well, I've had a lot of people ask me about my back, and when I explained to them that I'm virtually pain-free, I have recommended, since my surgery, 3 people to Dr. Bonati. And my comment to them was, it worked for me. You need at least a consult. Get an MRI, get a consult.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
In this final segment, Dr. Bonati usually encourages you to help make a difference by voting for new leaders who could help make changes in Obamacare and guide our nation back to what makes it great. He is happy to join you after the recent election and feels this is a turn in the right direction, but there is still plenty of work that needs to be done.
We also discussed how taxing medical devices is hindering the development of advancing medical equipment like CAMLS and the tools used to perform the Bonati Spine procedures. So Dr. Bonati, what an exciting turnout with this last election. You've been talking from the onset of this particular program about how people need to participate and take an active interest and vote out the current representatives that we have so that we can change what's happening in America. And well, as of last week, that happened. What do you think about those votes?
The American vote, that is the most cherry type of responsibility that you have in this country to be able to make the country perform decent. The individual who is lying at you, who is giving you a program that's doomed to fail, who's saying that this program is not accurate for this country, and is saying that the people who's voting are idiots, this is not only an insult, this is a situation that people need to be responsible. We cannot tolerate any more irresponsibility on the legislators. I feel very strong that when you do something, you need to be responsible. And if you are not responsible, then it's a chaos. And that chaos is that breeds individuals that they are affecting the whole nation. This race situation is a tremendous amount of irresponsibility from the Democrats, and the healthcare is an irresponsibility of the Democrats. We keep digging in this political arena, and we found that there's no common sense on this group of people, that they are elite, and because they are elite, they are untouched, and because they are untouched, they can be irresponsible. So we need to start to look in laws and representation, that when somebody promised to use something and they don't deliver, they need to be punished, or they need to be eliminated from the arena, or they need to be reprimanded, or they need to pay money for their actions. Once you start to make these people responsible economically, you're going to see how they change. They're not going to offer to you anything that they cannot deliver. But needs to be a change on this type of structure. I heard in the last meeting that we have that the ideal is to get rid of the Amendment 17. We need to talk about that. We need to talk about what Amendment 17 is and why that Amendment 17 was placed in the Constitution, and why that affects the whole politics of this country, and we are creating this type of individuals that they are practically untouched.
Dr. Bonati, both Ethan and I got to tour CAMLS in Tampa, and what do you think about what they do at CAMLS, and then with their technology and developing devices, how does that affect them as well as what you had to go through with developing your tools for your patented procedures?
One of the things that's incredible is if you have today an MRI that allows you to see and print in three-dimensional your spine, and you can have that one in 2 minutes. You lie down as a patient there, they took the photographs, they tell you. Then imagine with the elements that we have today that we can go ahead and do the surgeries that we're doing. Imagine that type of a tool for a surgeon who's going to know now pinpoint exactly what is the problem for the patient.
You're talking about such advanced techniques, but what happens with that device tax that the government has?
The tax for the advanced products in medicine needs to be repealed, needs to be immediately eliminated, because the problem that we have with that is the industry is walking out from medicine and they are start to use poor technology, and we will start to look like Europe. We'll have one MRI that's going to serve 6 million people in a state or something like that. It's because technology is always based on production and income. If you produce something that doesn't bring income to the company walk out and look for another direction. Until now, medicine is a very productive.
Thank you for watching American Medicine Today. If you have any comments or questions, feel free to contact us at the number below. When you do, please speak clearly and leave your name and number. You can also tweet at Dr. Bonati or hashtag American Medicine Today or hashtag AMT. If you are a doctor or a medical innovator and would like to be featured on our program, please email request@americanmedicinetoday.com. We respect your views and opinions and would like to hear from you.
Thank you for watching American Medicine Today, presented by the Bonati Spine Institute. Please look in your local listings for our next regularly scheduled program. To hear more from Dr. Alfred Bonati and American Medicine Today, tune into News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
The preceding program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.